co-chair of the South African National AIDS Council, that's the Deputy President, Paul Mashatile, today set to deliver the keynote address at the National World TB Day. It's being marked at Port Shepstone in KwaZulu-Natal. That's where we find SABC News reporter Nonhlakanipho Magwaza, who joins us now live ahead of that event starting. And Nonhlakanipho, of course, great anticipation to hear what the Deputy President might say, given the impact that TB still has even on our society.
Good morning, Ayanda, and to the viewers at home. Yes, we are here at Kamalake in the Ugu district on the south coast of KwaZulu-Natal. As you know, that it is World TB Day today, and the fight against TB is an ongoing struggle. As you know, that here in KZN, we're still leading in the TB numbers. The Deputy Minister, as well as the Minister of Health here in South Africa, has just arrived. They are going to attend a small briefing here in this hall before making their way to the actual main event at the Kamalake Sports Center. However, we do have the Executive Manager of Stakeholder Relations at SANEC, Reverend Netu, my apologies, Nebutalu, my apologies, I got tongue twisted there, sorry. Please tell us what can we expect to happen today. We do know that the Deputy Minister, Mr. Paul Deputy President, yes, my apologies, okay, is going to give a keynote address today. Just take us through what is expected throughout the program.
Yes, he's going to get a briefing from officials, from the CEO of SANAC, Dr. Kulu. From here, the Deputy President is going to visit a number of households, 3 in number. And the households are very symbolic because they are of people, men in particular, who are infected with tuberculosis. And the Department of Health officials will do what we call index screening. Because very often when one person is infected with TB, if they are not on treatment, they are likely to infect 15 other people. So that is why if one person is infected, officials have to go to the houses to try and screen them. So this is going to be symbolic to make a call to South Africans that if you are actually diagnosed with TB, insist that your whole family is actually screened. From there, we are going to go to Ugu Sports Stadium, where he is going to deliver the main address of the nation on the state of the epidemic in South Africa at the particular moment, as well as the intervention that are being made by both government, civil society and the private sector. And he will be joined, of course, by the leaders of civil society. Mr. Solindu, who is going to be joined by the leaders of the private sector.
Now, Reverend Nebutalu, we do know that here in KZN we are leading in the numbers, high numbers of TB cases. What could be the cause of this?
KZN has been a leader, for instance, in HIV. Now, HIV, TB often infects a lot people whose immune system is depressed, so is weak, as we call it. So we can say that one of the reasons why the TB rates are very high here they correspond with the high rates of HIV. But we also know that TB is often called is a disease, primarily, not entirely, that infects poor people. So the conditions in which people live, informal settlements where there's little ventilation, it's actually a breeding ground for TB. So that is why also here you have got a lot of informal settlements. You find the districts here of Ugu, what we have found out is that there are people who come here who move between here and Durban. And very often in Durban, They are living in those informal settlements and so on, and they are likely to be able to get tuberculosis because of the conditions in which they live.
I do believe that you are going to rush now inside with the Deputy President as well as the Minister. I'll just let you go for now. And as you heard from Reverend Nebutalu, he did mention that the Deputy President will be giving a keynote address, but before that he'll be visiting a couple of homes in this area. He did say that in this area, because of people who are living in urban areas as well as in informal settlements, when they come back home, those people who have not tested are infected with TB, and when they come here, they spread the TB. And he did say that the Deputy President will also announce interventions and progress made in fighting tuberculosis here in South Africa. Back to you in studio.
All right, Nonhlakanipho Magwaza, live to us there from the Ugu district in KwaZulu-Natal. For now, thanks very much indeed.